Welcome to my educative channel. I'm Dr. Ricardo Hoogstra, and today I'm going to talk about a theme that for me is very important, and this is the importance of cheekbones in the aesthetic facial. When I talk with a patient about the necessity to feel the cheeks, generally they don't understand me. They think about a natural result, but this is wrong. Here I'm going to show why it's so important. This is my curriculum. If we see this patient or that one, we can see there is almost no difference between the cheek and the lower eyelid. The lower eyelid is a continuation of the cheek. This cheek have a lot of volume, and also there is no limit between the lower eyelid and the cheek. Also, this beauty. This one with a big cheekbone, or this one. But if we see here, we can see there is a dark circle, and the lower lid cheek junction is here, and here is the not lower lid cheek junction is like a continuation. When he get older, we can see the same problem. And also we can see here the lower lid cheek junction here, and this patient, this actor, lack of volume. We perform aesthetic procedure, and here we can see the increase of the volume of the cheek. That's a lot of wrinkles, but the increase of the cheek improves the aesthetic of the eyelid. Here we can see the beauty. Also, there is no lid cheek junction, just the cheek is a continuation, or the lid is a continuation of the cheek. But if we see this young patient, we can see the lower lid cheek junction is very low, and we can see a dark circles because the cheekbone has a lack of volume. If I perform a lower lid blepharoplasty, is never I'm going to have a good result if I not give volume to the cheek. Here we can see lower eyelid fat pads, and also here we can see the lack of volume of the cheek. But this is the difference after my blepharoplasty without skin resection and the voluminization of the cheek. And this is very natural result. It's very aesthetic. It's very pleasant. And nobody knows that this patient have a voluminization of the cheek. But all these patients, when they come to my office to perform a blepharoplasty, almost it is impossible they understand this, because I perform a lot of video talking about this, and now I have more patients that come to my office and say, I understand, doctor, I'm going to perform lower eyelid, upper eyelid with your technique, but also I need a voluminization of the cheek. And now it is easier with the educative videos. And when you get older, you can see a lot of wrinkles, but also the lack of volume of the cheek. If I perform my technique of tightening the skin with carbon dioxide laser, I shrink the skin, but it's not a completely good result I need volumization here. And here you can see this oval is a vertical oval because the lower lid cheek junction is here, but here is horizontal with a young patient, beautiful patient we saw before. And here is the shortening of the lower lid cheek junction. Here you can see the beauty. It's like the first actress we saw. Almost have no point of intersection between the lower eyelid and the cheek. It's like just one unit. You can see the beauty here. True beauty. The skin tightening of carbon dioxide laser, the contraction of the skin, the rejuvenation of the skin, but also is so important the volumization. And I hope you understand. See you in the next video.